I was part of a study led by Professor Gordon Cook looking at COVID-19 infections in myeloma patients in the UK. And this was obviously a very early study. We have to caveat the data by the fact that these were patients who were tested positive. And at the time we were collecting the data, testing was still not widely available. So these are patients who were probably at the highest risk end of the COVID-19 infection. But what our data showed is that the risk factors we see in the ordinary population for severe COVID-19 infections, such as hypertension, COPD, and other comorbidities, really add to that risk for patients with multiple myeloma. Age is a key factor. But the other thing we did find is that it's active disease that's associated with the poorest outcomes, whether it's at diagnosis or when patients have got relapsed and active disease. And that's subsequently been followed up by a paper by AJ Chiari, which is an excellent international collaboration. And he's shown similar things, that active disease, whether it's at diagnosis or at relapse, is associated with poorer outcomes, as well as age and comorbidities, and obviously ethnicity. I think one of the things that hasn't been shown is that there is a treatment-related risk. So whether you're on immunomodulators, proteasome inhibitors, anti-CD38 antibodies, or you're a transplant patient or post-transplant, the treatment doesn't seem to impact on outcomes. So I think we know that the biggest risk factor to patients, apart from their other comorbidities and their age, which you can't alter, is having active disease. And I think what that tells us is that if we're faced with a myeloma patient, we need to treat them promptly without worrying about the pandemic. We have to get the disease under control, because that gives the patient the best chance of not getting severe COVID infection, and probably is associated with a readjustment and improvement in their immune system. Whereas when they have active disease, their immune system is probably not able to cope with the assault of COVID-19.